We now have a closing keynote by our new dean of the School of Public Health, Stefano Bertozzi, who we're very, very excited to have with us both at the school and here today. And he comes from a long history of from the World Health Organization to the Gates Foundation to many other areas and organizations. And I think that his vision kind of applied to this long day of many interesting points of view will give us some strategic ideas and forward thinking around the matter and how we can kind of link across the campus, which is what the point of today was about.
Thank you, Eva. I had a little panic attack when I realized that my name was on this program to give a keynote address, because that would suggest that I know something about the subject matter being dealt with today, and I'm not an expert on anything that we've been talking about today. So I won't use the word keynote, but I also will not keep you terribly long, because I know this is also the end of the day. But it was very interesting for me to listen to this full day of extraordinarily diverse talks, and I realized that I actually have far more connection to what happened today than I expected to when I came in. To start with, I grew up in a family of restaurateurs, so I've been in the food industry for generations in my family, and I spent all my young years chopping vegetables and cooking meat and various other things in the restaurant. So I was actually immersed in it. And then my parents, who, while certainly they didn't grow up on farms, they both had this extraordinary desire to, I think my father, Italian, decided he wanted to relive the spaghetti western fantasies of his youth, and my mother wanted to relive the Dude Ranch fantasies of her youth. So they picked up and moved to rural Colorado, where we were 6.71 miles from the nearest town, on a ranch that turned out to be the ranch that the kindergartners would come and visit every year, because we raised our own chickens and ducks and geese and pigs and goats and sheep and cows and horses, and we killed all of them and ate all of them and kind of lived that life that some of you have been describing. And I continue to this day to be very interested in cooking and eating. So I didn't expect as much of that stuff to be here today as I found. And so there was a lot that very much resonated with me. But the reason I was happy that I was here today was because I'm the brand new dean of public health, and it's my job to kick off a new strategic planning process here for the school. And I need to develop a sense with our faculty and our external partners and internal partners of how much of a role should nutrition and food play in the vision that we collectively develop for the school for where it should be 10, 20 years from now. And so I thought that when I looked at the program that this would be a very interesting way for me to become more educated about the issues, but also very importantly about what our faculty were doing in this space and with whom were we partnering in this space. And I think in that regard it has been certainly very helpful to me. And that meant that throughout the day I was listening and thinking, well, how does this knit together and what might this mean? In other words, if I'm sitting here trying to generate some hypotheses, what might be very important areas of focus that what I'm hearing today would suggest for what the school might want to do? In other words, if I were to imagine, if I asked all of you what you would be suggesting, so that's what I've been thinking about, and that's what I thought I'd just share a few thoughts with you. The one thing that occurred to me as I was listening was the silos in which we work. Because we heard about different disciplines, and we heard people talking about what they felt outside of their disciplines, but we haven't clearly made those linkages. I mentioned over the break to Marion Nessel. Said I wasn't going to do it, and then I did it. She told me, remember, it's the verb, not the chocolate. I still didn't get it. But I'm a physician economist. I worked mostly on AIDS in my professional life and a lot of evaluation of programs. The other thing, by the way, just going back to what I first said at the beginning, as Leah sort of mentioned, I was very much involved for 11 years in Mexico in evaluation of the impact of major social programs, including major nutrition programs. But what I was thinking about when she was talking about the role of fast food in this country in particular, and thinking about the number of economists that have written about the influence of the agricultural subsidies on agricultural markets, and subsequently to that, the extraordinarily shift in that when biofuels started to come on the market and the public policy incentives for those, it seemed to me that we're not taking advantage of certain opportunities. And the fact that we have, some of the world's finest economists on this campus who work on those kinds of issues, it seemed to me that we have opportunities for synergy and interaction. Somebody mentioned, I don't remember who, that maybe it was Mariam that showed a picture of Burger King in Mexico. And I just was going to sort of disagree there, but it's a very subtle disagreement. I think that what's happening in much of the world outside of the U.S. is not fast food in the sense of the McDonald's and the Burger Kings. It's junk food. And in particular, in the case of Mexico, soft drinks. I mean, it was extraordinary for me. We built a house in Mexico, and our entire very large workforce of people who spent many hours cutting rock and building house would go out at lunch, come back with a stack of tortillas and one of those 1.5 to 3 liters of Coca-Cola, and that was lunch. And it was sort of like a engine for creating diabetics. And the country is under a tsunami of diabetes. And so one of the big issues in Mexico is figuring out how we're going to deal with diabetes. And it turns out that we're failing upstream and we're failing downstream. We're not doing a good job either on reducing the creation of diabetes. And one study by one of the largest health systems in the country looked at the relationship between visits to a physician and control of blood sugar amongst people who were diabetic and found that they were uncorrelated. So extraordinary lack of ability at either end of the spectrum. Now, this issue of siloization is, I think, an extraordinary opportunity. What I said when I gave sort of my job talk for the School of Public Health, I said that my impression is that almost all of us who went into public health because we wanted to change the health of the public. And along the way, we all chose different ways to do it. Some people do it getting their hands dirty in the field and helping to change crop yields. Some people do it in the academy. And those of us who either have always done it in the academy or who, in my case, more recently have decided to do it in the academy, do it, I think, because we believe that contributing through research and through education and through service is the way that we can ultimately have a major impact on public health. And you don't have to sit in this room for more than a few minutes to realize the passion in this room about changing global hunger and improving global nutrition. People are not here ultimately for goals that are trivial. But we all live in a system which rewards other things. It rewards publication, and it rewards exclusivity. And it rewards elitism in education. It certainly does not reward volume. It certainly does not reward impact. So figuring out how we, all of us, work to achieve that goal of impact in a system which isn't necessarily, in which the incentives are not aligned necessarily to achieve that. That's one of the things that creates to creating and maintaining the silos that it's so obvious from today's discussion we need to find ways to bridge. And so it seems to me from a strategic planning perspective, we have to find ways to get people to create incentives that encourage the bridging of those silos. And the talk that came later by Mark about the microbiome actually ended up touching very many people throughout the day. And it was a good example for me of an area in which I said to myself, we are at the threshold, at the brink of extraordinary work. a little bit, and it was mentioned in the talk, a little bit the way it was when we were discovering the human genome. But not long ago, I was meeting with the head of BGI. It's the Beijing Genomics Institute. It's by far the largest gene sequencing organization in the world. I don't know how many sequencers they have, but they have 4,000 data analysts, just to put a scale on the size of their enterprise. It's huge. And they're a nonprofit, as it turns out. And they've decided that the microbiome is really important, so they're sequencing the entire microbiome of thousands of people. Now, the question of how do you marry some of the emerging capacity, and I just mention that because, what used to be impossible very short time ago, then became possible but extraordinarily expensive, then became very expensive, then became to the point where very soon we're talking about $100 for a human genome. We're talking about the kind of economy of scale and scope and everything else that enables us to think about generation of massive data. And we've mentioned here, the extraordinary diversity in the environment to which we are exposed, both chemical, we heard about pesticides, and biological, in terms of the microbiome, maybe what lives in and on me, but there's some other word for my environment, right? Which you call it exposomics exposomics or whatever it is. I think of exposomics being more chemical, but there's the equivalent biologically, right? So what are the genetics of that environment? Then the question of what are the genetics of the environment that's in me? And then the other really exciting thing, which nobody mentioned today, but it's also really cool, is the whole issue of epigenetics. And the idea that genetically, our DNA may be the same in all of our cells, but what enables us to be so extraordinarily differentiated is the fact that gets modified over time, and different parts of us have different epigenetic phenomenon going on. And it turns out that those, of course, relate enormously to both our microbiome and to our experiences. So this issue of what happens intrauterine affects us post. Now, all of those kinds of things. Now then, for those of us who are more infectious disease oriented, we're of course also interested in the genetics of our pathogens and in how the genetics of the host, the person, interact with the microbiome and the pathogen and the stuff outside of us. And it turns out that fortunately on this campus we have really good statisticians, because this stuff is really complicated analytically, right? And we are generating, or able now to generate, or will soon be generating, huge amounts of data about all of these environments, the inside environment, the outside environment, ourselves, the pathogens. And it strikes me that there is, if I were to pick one thing out of today that is like, boy, this is A, really exciting, and B, our current models won't make it happen. Because no one professor in his or her lab can begin to deal with that level of complexity. The only way this is quintessential big science, but the cool thing is, it's not big science that has to happen with a super colliding God knows what. It's big science that can happen in a distributed way if you come up with the right mechanisms for sharing information, for working together. But it can't be individual R01s that are funded by the NIH with individual professors that deal with this population in this village in this country on this internal or external whatever ohm, right? So I think we have to think big about that. And frankly, it's not just not one professor, it's not one school, and it's probably not one university, and it certainly involves geographic collaboration. So for me, that was one very sort of interesting and exciting thing that came out of the discussion today. I also couldn't help but notice some of the contradictions that came out of today. And when I see contradictions, I think that's interesting, and it suggests that we're not fully resolved scientifically. So to hear in the morning from Tom Carlson and in the afternoon from Miguel about the robustness of traditional systems and how if we basically just left, I'm exaggerating to make the point, if we kind of left people alone, they'd be fine, and we've screwed it all up. But in the middle, we heard from Alicia talk about the Sahel, and she was talking about the Sahel. I've spent very little time in that part of the world, but I have been quite a bit of time in Guerrero in Mexico, which frankly is not so terribly different in terms of its dryness and in Mexico relatively high fertility. And it doesn't strike me that in those places we can rely on traditional systems, because the traditional systems are broken relative to the number of mouths they need to feed. So we clearly have a mix of stuff happening here. I also spent the last 4 years at the Gates Foundation, which is something I'm sort of loath to even admit after. And it's obviously, I wasn't working in agriculture, but it's an organization that believes that technology and science has a lot yet to contribute to addressing the problems that we're dealing with today. And I have to say, I'm a believer in technology. I think that the enterprise of discovering why we're observing the things we're observing and how we could counteract them, and the potential for new and different technologies to help us do that. The fact that we have misapplied technology dramatically in our agricultural production systems, that does not for a minute tell me that we should be anti-technological in our search for solutions, because I don't see how the Sahel could possibly expect to come out of the situation they're in without the help of significant technology. I was actually, what I was going to say at the beginning was I hope you guys are going to interrupt me, but I kind of want to stop talking. I mean, I could go through all kinds of individual talks, and I have sort of comments and issues, but it is already 4:30. So what I'd like to do is just leave a few minutes for a little bit of interaction and ask you guys the question that I was asking myself. And that is, we heard about a very diverse number of things today. But if you had to say that this extraordinary university, potentially in partnership with others, could make one or two big bets in the broad domain of stuff that we were talking about today, where would you see that? And I would just come back to this issue that I said at the beginning about impact. We heard about a number of extraordinary things today. And whether it's a school garden here or a community that grows coffee there, I'm a public health guy. And the public health guy in me is worried about the global burden of disease, the global burden of malnutrition, the global burden of obesity. So while I can be really interested in a proof of concept that happens in some community because it teaches me something about what is possible, I'm only really interested in that thing if I believe it's mass scalable. So when I hear about a wonderful local response in North Berkeley, where I happen to live or whatever, I'm excited by that. I think it's terrifically interesting. But I'm really excited by it only if I think that that can turn into a social movement which changes the world. Okay? So the one thing I was surprised that nobody mentioned, as we were talking a lot about the social issues around food, is that we have one example, quintessential example in my lifetime of where a social movement has changed the world in public health. And you might think I'm thinking about HIV, and I could use that as an example, but that's not the one I was thinking about. I was thinking about tobacco. So we have taken extraordinarily powerful corporate interests, and we have changed the world. Now, it's not changed everywhere, but sitting in Mexico, as I did for 11 years, and watching them ban tobacco in restaurants and bars in New York, and how long it took for that to go to Paris, and how long it took for that to go to Mexico City, where we banned it in all bars and restaurants in Mexico City, suggests to me that if you can create a social movement, that you can really change the world. But otherwise, you can do a great job in a village in Mali, you can do a great job in North Berkeley. If you don't have a replicatable, expandable, scalable example, it's not going to help from the perspective of a public health guy. So just with that caveat, I'm very interested in anything anybody might say and open the dialogue. Eva, you were raising your hand.
I was just going to comment on I think scale, you can see it in different ways. I mean, for me, scale doesn't mean you take one thing and you apply the same thing to everyone. I mean, you mentioned social movements. It's clear you're not thinking that also. But like the Campesino, for instance, which we again mentioned, is already millions, hundreds of millions of farmers that are already linked, and they are doing something, and they're doing it to scale. We just don't know about it, or most people don't know about it. And I think that there's a lot of grassroots movements that wish I had time to be more part of, that are thinking about new ways of growing food in this country and others too. I mean, there is a grassroots movement, and I think that social movements is a way to make that change. I mean, it's kind of what you can do, and I also think that there's things you can do in university, but I do think that there's, the scale is people too, is movements.
What I wanted to say about that was that from the academic perspective, right, I need to see how that matches to the map of morbidity and mortality, right? It's not enough for me to hear that there are 30,000 farms and schools, unless I can see that mapped against, I'm blocking the name of the guy from Kaiser, Preston, against Preston's map. If you show me that the farms and schools are happening in the red areas, then I'm going to believe that we're focusing this movement and these resources on where the problem is. If we're creating farms and schools in North Berkeley, then we're not. And right. So that's why I say but those are the data that I need to see to believe that that what we're doing is going to create the kind of impact that we're looking for. Miguel.
Well, you're a new dean. I've been a professor for 33 years here. So what is your assumption of this university? You think this is a public university that is producing public goods that are responding to the needs of the people? Because if that's the case, why is it that we don't have thousands of gardens in those areas, since we have been here in the University of California, land-grant university? We have been here more than 100 years, and we have not been able to put one garden in those areas where they should be.
No, what I said was,
assuming that this university is going to respond to the needs of the poor, with the corporate influence that there is here. So you're a new dean, and I think that you need to also understand a little bit that I'm sure you understand the environment and the foundation that you were in also influenced the research agenda at many universities too, and international centers. So how are we going to respond to these needs when our agenda is not being shaped by the dialogue with those people? So we have to have those people in the board of the university in order for us to understand their needs. But we don't. Instead, we have BP putting $500 million here to promote biofuels. Those people don't need biofuels. So I just wanted to see where you're coming from in terms of what do you think this university is? This is a public university that is producing public goods? Or what is your perception?
What I said was that I think that we're here because we care about achieving impact. And I mean, the only, I like to be contrary, so I'll be contrary. When I started working in HIV, we couldn't do anything for anybody. Then along came the corporate world, which discovered drugs, which kept people alive in this country, in Europe, and Japan, about $15,000 a person. And people in the developing world were condemned to death without access to that. And I was, at the time at WHO, I met with industry. We tried to convince them to have differential pricing, even made economic arguments that it made sense, and there was a refusal. But then we got smarter on the activism side. And with the TRIPS agreement, with just World Trade Agreement, Brazil and South Africa said they were going to start compulsory licensure. We got a big enough stick. We changed the incentive structure. And now we have 10 million people on treatment in the developing world. Now, it wouldn't have happened if we'd left industry alone. It wouldn't have happened if we didn't have industry. So I don't think that we can wish for a world in which the private sector doesn't participate in food and agriculture. And I think that we have a responsibility to figure out how to create an engagement that is constructive and productive. And I don't think you're not saying that, but sometimes I can feel like it has to be either or. I do believe that we can be productively engaged and productively confronting at the same time.
So I have I see that there's a parallel here. Social movement seems to be kind of like what people think could be the solution. So myself, I've been studying higher education for 14 years. I'm doing a PhD in entrepreneurship. I specialize in something called social entrepreneurship, which is kind of like taking the divide you have now with the private and public sector and merging it into one entity that it's focused on impact, just to your point. And so what I'm building through my research is something I call the urban farming platform. So it's about urban farming platform. So where it's connecting to farmers through farmers markets and bridging the gap between consumers and producers, and then trying to eliminate the middleman in that process. But where there is much a social mission within that, using technology to have those who are able to deliver fruits and vegetables, or to do farming, to be able to do that and be sustainable in doing that. What we have identified is kind of a base of a pyramid problem here in the U.S., and then addressing those problems here, we're able to build technology that can easily be adopted in the developing world, in Africa and Latin America and all that. So I'm hopeful, based on the findings I have in my research, that there is a way that doesn't require private sectors to maximize profit, and it doesn't require wealthy families to make massive donations to get something up and running. So you can actually build that social movement and empower individuals to do something and to make a difference day one. So yeah. But also to the point of like this birth rate, in Norway, where I'm from, had a very high birth rate. So Norway was really extremely poor until the late 70s, and it was very based on community. And you would have families with 10 to 15 kids, and now it's down to 2 and 3. And you can say it's because we found oil and whatnot, but I would also argue that because we had free education and free healthcare, and then there's not this divide that you see here, for instance. And so if there's certain aspects in how you grow a community, then where you move from agriculture to more service, then people are going to have less kids as well. But having that many kids back in the day wasn't abnormal, and it wasn't a bad thing either. So I don't think that's necessarily the problem. I think it's more about helping these people be able to ensure their future without having kids to be able to do that. And for that, you have to build the whole social structure and infrastructure within the community to be able to do that. So, yeah.
That's interesting.
Just following up on those comments, which I agree with both of them. First of all, I don't think that HIV treatment is the best model to think of when thinking about solving food crises, for the simple fact that there we actually do have a very reductionist solution that thankfully technology has given us. Maybe a better way to think about it would be HIV prevention in terms of much more complex and global problem. But this friction between technology and indigenous knowledge that you identified is one that I find very fascinating, and it plays out in all these places. And I think it's something that's very worthy of a lot more exploration. It's something I've spent a lot of time thinking about. And one of the things that I've come up with over and over again is that in order to use technology appropriately, you have to first really understand natural systems, as Miguel was describing. I mean, a great example is a farmer I spent a month with in Missouri, who's doing holistic grazing, where he's actually grazing cattle the way they used to graze in the 1800s. Bison used to graze in the 1800s. And he's managed to restore the prairies there and is actually putting carbon back into the soil, so solving global warming through cows. And he is using a very advanced technology, which is this advanced fencing system, to do that, but he is recreating a natural system with that. And I think that very much applies to healthcare and public health research as well. We have to know what is there before we can start to bring in technology, and also to genetically modified foods and so on. So sort of
no disagreement. I was just saying that I think if we set up a dynamic wherein it feels like we cannot work except with local farmers and our farmers markets, and we would be sinful if we speak to the private sector, that's a dynamic which is unlikely to solve the massive problems we're talking about globally. That's all I was saying. I completely agree with everything you said.
Yes, I just wanted to stress out a point that Miguel made about the community and maybe the involvement of the community in academia. So I come from a global health and academic background, and I'm now in a nonprofit in the Bayview Hunters Point, so very local. And I'm working directly with the community, and I was just last week in a community meeting to start my research program. And, I presented them research and asked, okay, what do we want to do? And really their feedback was like, well, research is great, but, we have these people from UCSF or wherever, they come in and they take data and then they disappear.
Go away.
And we don't see anything put into action. We don't see anything translated that is really benefiting us. So I think what Miguel said, it's how do you see eventually involving the community within academia and really maybe bringing the community closer to academia, because there is a schism there and there is a breaking point that makes them even fearful about even having research done on them, and especially here with all the history, especially in the African American community and the history of experimentation and abuses that have been going on in the 50s. And also I think bringing the community in will help having, all this indigenous knowledge brought in, because us as academic, we don't have that indigenous knowledge really. So do you see anything that would eventually happen in that way, and how would you do it?
May I just add something to that? I'm so glad that you talk about this, because I come from the non-profit sector, and I perceive this black and white approach, public versus private sector, and the non-profit sector is a bridge there that is like designed for the academia to support and get information from if there is a true partnership, like you said. And furthermore, this non-profit sector appears at the same time and is going through a major turnover because of leadership. So at the time that a new leader comes to take the NGO or the non-profit, you bring in business models to make it sustainable, and then the missions of these institutions that are being preserved against all odds in the community are very much at risk. So I capture your words about a good marriage and sharing. That's where the wealth is, and is right at the doorsteps of the university in Alameda County. Probably you do have already in the Department of Public Health an amazing, experience with the Health Initiative of the Americas that I've been participating as a coordinator for disabilities. And the outreach of the Health Initiative at times has been 500,000 people, with campaigns on all the issues of public health for Latinos. So it looks like as the initiative grew, it became a monster that is difficult to contain within the university and needs to be redesigned, but at the same time is not to be abandoned. It's to give adulthood status to the initiative, but also at the same time use this amazing network of professionals and institutions and nonprofits that need the support of the university as much as you need the input from the community.
No disagreement. I mean, I haven't spent most of my professional life living overseas because I disagree with you. If you want to work on something, it's a good idea to connect deeply with the people with whom you're working and to understand the problem. I think that's always a challenge for the academy. One way to do that is by building very close partnerships, and that's a challenge. I mean, when I mentioned the incentives before, that's one of the incentive challenges. If one of the things that makes Berkeley one of the world's top universities is the fact that very few people get to come here, and very few people get to benefit from our resources, then things that would change that would cause many more people to get some piece of a Berkeley education, for example, would threaten that exclusivity. Interesting thing to think about. I mean, especially in this era of massive open online courses and other ways of democratizing access to the elite. Right?
I think if you were a dean from Mars and you came to the Earth and you look at the biggest social movement in the last 50 years, it would have been the great changes that have taken place in the lives of women and in the ability of women to control their fertility. And half the world now has replacement level fertility. Brazil and Mexico have made enormous changes. South Korea and Cuba have identical fertility declines. They're rather different in religion and the way they organize their economies. I think what's going to drive a lot of the public health problems in the second half of the 21st century are the least developed countries where these advantages have not been offered to women and where we've still got very rapid population growth. So on the present demographic predictions, the largest single group of people on the planet in 2100 will be trapped in those least developed countries unless we really make the investment that we need to make. And some of them have rather difficult situations like child marriage. And so, but I think we know what to do, and I think we should put a lot of concentration to give to the least developed countries the privileges and the joy and the freedom that we've been able to give to women in much of the world over the last 50 years. All right, there's still obviously a long way to go, but I think that should be one of the ambitions of our school.
I don't think we know what to do, but I agree with you that it's a very big problem. But I think that the idea that if we just had some money we could fix the fertility problem in Niger, I don't think that's true.
I think we could begin to keep girls in school more. We've had some experience of that, and that obviously makes a difference. And that's what science is about, isn't it? It's the problems that are difficult to solve. I entirely agree with you. But it's the problems that are difficult to solve that we should put a lot of focus on, and not just the easy ones.
Right. But you will agree that it's not immediately obvious how you keep girls in school in Niger, right?
Yeah, I agree.
Especially at scale. I mean, all of us can probably do it in a couple of villages. But
one word.
Yeah, we're out of time.
Yeah, it's over. You're the new dean. What we do at the School of Public Health, in addition to lots of important research, is train students. So please talk just briefly about the kind of person that you think we need to be training in order to go off and do the work that needs to be done.
Well, as I've only been here 5 weeks, and I think that it's my job to work with our faculty, our alumni, our students, our external partners to answer that question. But I'm absolutely convinced that many of the models that we have in public health education in general have been models that we've had for a long time, and the world that we are serving has changed. And to be honest, I think that's even more true in medicine. But that's a harder nut to crack because the economics are so much, talk about corporate and financial interests. I mean, we've got it easy in public health. But I think the kinds of questions I ask myself is, we've spent a lot of energy collectively across, especially this country with Canada and also Mexico, because we were the first in Mexico to join, to become accredited by the association, on defining what is the core curriculum for somebody who is a public health expert, which quintessentially is a master's in public health. And I think it's time for us to ask ourselves the question of what are, in fact, the workplaces that we expect our graduates to go into, and what are the sets of skills that they need for those workplaces. And I suspect it's not as extreme as medicine. I mean, I'll just take 2 seconds to explain what I mean by how extreme in medicine. Ask any doctor, including the ones we have here, if on the 1st of July you were to be hospitalized at San Francisco General in the intensive care unit, and all of the attendings and all of the chief residents were away, and you had a choice, am I going to ask the nurse to write my orders, or am I going to ask the intern to write my orders? No doctor in the world would say, get the intern to write my orders. So 4 years of medical school doesn't begin to prepare you to be the boss in the intensive care unit as well as being a senior ICU nurse does. Ask any doctor. Yet, that nurse has no opportunity to enter that same residency program and become a fully qualified physician, while that wet behind the ears, completely inexperienced intern has all of that, right? Something doesn't match there, right? Because obviously it's not capabilities that we're judging on, right? It's how well you did in organic chemistry that matters in terms of the differentiation there. There are analogies in public health without prejudging it, right? What are those sets of skills and knowledge and capabilities we need for different workplaces? And what does that imply about what our educational offering should be? Which of those can be done remotely, virtually? Which of those need intensive interaction? Which of those are more about learning how to learn and how to find information that exists already? Which of, those are the kinds of questions I'm really excited to dig into. And I think we have an opportunity. It's been long enough. We had the Flexner report at the beginning of the last century for medicine. We've sometime later in the mid-30s, we had that for public health. I think it's time for us to ask ourselves those questions. And with that,
Thank you very much, Stefano. And thank you all for being a wonderful audience today. I do want to say this has all been filmed, and we're launching our new website at the end of this month, and so that will be there for all of those who might have been on the BART strike, and really for you to enjoy as well. And hopefully we will continue the wonderful conversations that began today. Thank you all.